Choline and phosphatidylserine are lipid components, and they support the structure and the function of the neurons that are involved in memory acquisition and recall. Choline plays an important role in the neuronal processes that underlie memory via two different mechanisms. First, the choline serves as a precursor for the neurotransmitter acetylcholine, and this is important for neuronal signaling that's involved in memory. Consequently, drugs that increase acetylcholine levels are an important part of treatment for Alzheimer's disease. Second, the neurons in the brain have high levels of phosphatidylcholine. This is a lipid found in the cell membrane. It's thought diminished levels of the phosphatidylcholine in the neurons contributes to memory loss and other forms of cognitive decline. In animal models of memory loss, choline supplementation relieved the memory impairment by improving the process of memory consolidation. Trials in humans have also yielded promising results. Supplementation with alpha-glycerylphosphocholine, or alpha-GPC, has been found to improve memory and concentration. In young healthy individuals, alpha-GPC has been shown to prevent drug-induced amnesia. Some of the benefits observed include improved attention, memory, concentration, and cognition. The compound has also been found to reduce memory loss and other signs of neurological damage due to stroke. Another study found individuals with higher choline intake performed better on memory tests, such as those that measured visual and verbal memory, and other measures of cognitive function. Phosphatidylserine is another lipid that's important for neuron health. It's one of the most extensively studied compounds for memory impairment. Animal studies have found phosphatidylserine lessened drug-induced amnesia. In addition, multiple studies show that supplementation with phosphatidylserine, either on its own or complexed with other fats, improves memory in elderly individuals. Specifically, phosphatidylserine improves verbal recall of information, and it might improve cognitive deficits in elderly individuals with memory complaints, but without signs of dementia. The phosphatidylserine can also improve memory in people with attention deficit hyperactivity disorder. In addition to preserving the neuron health, the phosphatidylserine might be able to improve the memory by increasing the level of both glucose, aiding in the energy consumption of the neurons, and acetylcholine in the brain. Another clinical study found phosphatidylserine can enhance the effects of ginkgo biloba, a plant well known for its benefits on brain health. A 2012 study was conducted on the impact of a dietary supplement that contained alpha-glycerylphosphocholine, phosphatidylserine, vimpocetine, grapeseed extract, wild blueberry extract, ashwagandha, and uridine monophosphate. A cognitive assessment tool was used to assess the change in the cognitive performance from baseline to day 30 and day 60. The Global Impression Improvement Scale provided an overall clinically determined summary. 29 subjects completed the study, with no significant adverse events reported. The study also found a statistically significant improvement in 3 tests: the working memory, inspection time, and executive function. B vitamins, including folate, thiamine, pyridoxine, and B12, all have important roles in preventing amnesia. B12's role in maintaining the health of the neurons is particularly well established, since a lack of B12 can cause damage to the peripheral nervous system. Along with B12, the importance of folate and B6 for cognitive function have also come into focus. All of these vitamins are needed to reduce the levels of homocysteine in the brain, and homocysteine contributes to vascular dysfunction. The homocysteine levels tend to rise as people age, and they're associated with an increased risk of Alzheimer's disease. In addition to its role as a risk factor for stroke, homocysteine is directly toxic to the neurons, both in people with Alzheimer's disease and in healthy individuals. One of the ways the B vitamins help to prevent amnesia and other forms of cognitive decline is by lowering the level of homocysteine. This can also help in the synthesis of different neurotransmitters that are needed for the brain to function properly. Low levels of several B12-related markers are associated with low brain volume and decreased cognitive function. A study reported supplementation with folate, B12, and B6 for 2 years slows the cognitive decline and it improves the clinical status, while other studies reported that it can slow brain atrophy. Ensuring adequate intake of thiamine is also an important consideration for the prevention of amnesia, since the lack of thiamine can cause Korsakoff syndrome, a symptom of which is amnesia. The death of neurons within the hippocampus and other regions of the brain is thought to play a role in the development of amnesia. Acetyl-Carnitine is a substance and it's naturally produced by the body, and it has a variety of neuroprotective effects. One of its main roles is to help the mitochondria, colloquially referred to as the cellular powerhouse, to produce energy more effectively. Moreover, it can help to increase the levels of acetylcholine within the brain. Supplementation with acetyl-L-carnitine has improved neurodegenerative dysfunction in many different animal models, including Alzheimer's disease, age-related learning and memory impairment, poor blood flow or a stroke, and head trauma. The acetyl-L-carnitine also improved cognitive function, including memory in people with hepatic encephalopathy, a disease caused by liver damage. CoQ10 is a naturally occurring vitamin-like substance, and it's involved in cellular production of energy, and it might have some neuroprotective properties. A related compound, PQQ, also has neuroprotective effects. Studies of neuron cell cultures and animal models of amnesia found that both of these substances can improve cognitive function and prevent cell death leading to amnesia. One potential cause of amnesia is a stroke, and this damages the hippocampus and other parts of the brain by depriving them of oxygen, a form of damage that's known as ischemia. The CoQ10 protects the hippocampus and other parts of the brain from ischemic damage, suggesting it can help to prevent amnesia due to stroke. In animal models, CoQ10 and PQQ have reduced the behavioral effects of amnesia due to traumatic brain injury and amnesia-inducing medications. In other tests, PQQ and CoQ10 seem to work synergistically when combined. Omega-3 fatty acids are a class of fats, and they include DHA and EPA. In animal models, these fats were shown to reverse ischemia-induced amnesia, and the improvement was maintained even after the treatment was stopped. Increasing the intake of these fats, either by eating foods rich in omega-3 fatty acids or taking fish oil supplements, can help to protect the brain from amnesia. Studies on animal models of amnesia suggest the long-term treatment with omega-3 fatty acids can protect the brain from amnesia caused by low oxygen levels. Magnesium levels are higher in the fluid surrounding the brain and the spine, called the cerebrospinal fluid, than in the blood. This suggests that magnesium plays an important role in the central nervous system. In an animal model, a diet deficient in magnesium increased memory deficits after brain injury, and the administration of magnesium following an acute brain injury significantly reduced the tissue damage and it improved the behavioral outcome. In addition, a study showed animals that underwent traumatic brain injury and received a diet with less magnesium had a higher mortality and worse neurological outcome. Evidence also suggests people with mild to moderate Alzheimer's disease often have diminished magnesium concentrations in their blood. Magnesium supplementation also improves memory, and it reduces memory loss in many animal models of amnesia, suggesting it could be an effective therapy for treating or preventing memory loss. Although it's difficult for regular magnesium supplementation to gain access to the brain, scientists have developed a modified form of magnesium called magnesium L-threonate, which is better able to get into the brain. Ginkgo biloba is one of the most extensively researched medicinal plants. It contains two different types of compounds called flavone glycosides and terpene lactones, and these have a variety of health benefits. Importantly, the ginkgo might be able to improve the brain health in a variety of ways by improving energy utilization, preventing neuron death, and modulating neurotransmission. Trials on humans have yielded promising results. The plant improved the memory in healthy middle-aged volunteers, and it slowed cognitive decline in the elderly. Another study reported the ginkgo, after 14 days of administration, caused brain changes in activity that resulted in improved working memory. Ashwagandha is also known as Indian ginseng, and it's been used in Ayurvedic medicine for centuries. Studies suggest it could promote the growth, repair, and the regeneration of damaged neurons, especially those that were damaged by Alzheimer's and Parkinson's disease and other neurodegenerative conditions. Huperzine A is a compound derived from the Chinese plant Huperzine serrata. Its role in treating amnesia mainly stems from its ability to reversibly and selectively inhibit acetylcholinesterase. Inhibition of acetylcholinesterase leads to the elevation of the neurotransmitter acetylcholine, and this is important for memory. Some Alzheimer's medication also works by the same mechanism. In several animal models, Huperzine A improved memory and cognitive function. It was shown after oral administration for 8 to 24 weeks at 300 to 500 micrograms of Huperzine A. It improved the mental state of the Alzheimer's patients, and it was well tolerated. It can also benefit people with cognitive deficiencies due to vascular disease. In addition, it was also shown in animal models to promote the growth of neurons within the hippocampus. Vimpocetine is a derivative of the periwinkle plant, and it can be useful for treating amnesia due to underlying neurological problems. In addition to having neuroprotective effects, the vimpocetine might be able to enhance memory by improving the function of neurons in the hippocampus and other parts of the brain that control memory. Animal and cell culture studies have shown that vimpocetine can improve memory and protect the neurons from a variety of different types of damage. Women who are pregnant should not use vimpocetine. Blueberries are particularly rich in a class of compounds called flavonoids, and these can enhance the blood flow to the brain and optimize the nerve function. Many animal studies have found supplementing a diet with blueberries enhance memory. The effects of the blueberry supplementation can modulate some of the biochemical signaling pathways in the hippocampus, and this is intricately involved in memory. A small study on the elderly also found daily consumption of blueberry juice for 12 weeks improved the memory. For more on herbs, supplements, and natural treatment plans, check out my website.